As a parent, there is nothing more heart-wrenching than watching your child struggle with chronic health issues, despite trying every recommended traditional medical approach and then going fully down the road of natural and holistic health remedies. Because you've been to countless doctors, specialists, and therapists, filled numerous prescriptions, and explored various holistic and even biomedical therapies like diet changes, detoxes, and cleanses, and parasites, and vitamins, and supplements, and herbs, and infrared saunas, and all of these things. But nothing seems to work. Nothing seems to last. The frustration and the helplessness can be overwhelming, leaving you questioning if there's something that you're missing or that your child is just stuck this way. But what if the real key to unlocking optimal potential and healing for your child is doing all the things but in a completely different order? What if it's as simple as breaking things down into a more specific sequence or a batting order that aligns with the exact pathway of stress and dysfunction that caused them to get sick in the first place? Now listen, here's what's absolutely fascinating about the shift that we've seen in healthcare over the last decade. Because in the early stages of practice, 80% of our patients were already medicated before learning about the holistic, neurologically focused chiropractic care. And 20% of them knew anything about gluten, about dairy, vitamins, supplements, and drug-free approaches. But today that's completely flipped. 20% of our families and patients are taking medications, and the other 80% has gone deep down the roads of natural healing and drug-free health. But here's the concerning reality. Chronic disease prevalence has risen to nearly 30% in the last 20 years. And our average new patient today has more issues, more struggles, and various health challenges, which reveals a critical gap that most parents and even healthcare providers are completely missing, dismissing, and ignoring entirely. So first we need to understand the neurological hierarchy of health and development, because the nervous system develops first in utero. So it's acting as our air traffic controller for your child's body by coordinating vital systems like their gut health, like their immune function, like their motor skills and coordination, and big brain function like speech and cognition and emotions. Now, Dr. Bruce Lipton, who's a cellular biologist and researcher, explains that the function of our nervous system is to perceive the environment and coordinate the behavior of all other cells, tissues, organs, glands, and vessels, which is why the neural tube is one of the very first things to develop during pregnancy. Now, when the nervous system gets derailed and off track developmentally due to early life stressors, everything downstream gets thrown off as well. You can almost think about these stressors and the building and accumulating of them as an RPM gauge. There's preconception stress, there's the chemical side of things, labor and delivery, the emotional stress and strain, technology and academics. All of those stressors early and often shift that RPM gauge to full throttle, meaning it's going to turn on our gas pedal and get it stuck and locked on, and it's going to shut down our brake pedal. The rest, the healing, the digesting, the regulating side of our nervous system. And this is why nearly every child struggling with chronic neurodevelopmental conditions also struggles with digestive problems, a weakened immune system response, motor challenges, and sensory processing difficulties. Now listen, there's 3 sequential steps of optimal neurodevelopment. Now, step 1 is the nervous system foundation, because without proper nervous system regulation and function being activated and optimized first, everything else is limited in what it can do and the results you should expect. Now, step 2 is the motor system, because movement truly is life. And every childhood development expert knows that the motor development is the key to brain and nervous system development overall. But the muscles can't move themselves. They're kind of dumb. The nervous system must function properly first for motor coordination and planning to then develop and act properly. Now, step 3 is our gut and our immune health, which, while absolutely essential, is controlled first and foremost by the nervous system through the vagus nerve and our brain-gut connection, which means that the brain-gut connection comes before the gut-brain connection. So here's why the batting order, or that sequence of healing, matters most. So each individual form of natural, holistic, integrative care is amazing and does its job. But when we address nervous system dysfunction first, we unlock something within your child's brain and their body that makes every single other therapy work exponentially better. Now, this is why so many parents report that their children are finally seeing massive gains in PT and OT and speech once they begin getting adjusted. Because we're addressing the foundational neurological dysfunction that was limiting all other therapies from achieving optimal results. It's reopening neurosensory pathways that were once closed, shut off, overwhelmed due to stress and subluxation, but now are opened through neurofocused care, allowing for the proper development to actually be achieved. Think about it like trying to restore and rebuild a home that sits on a cracked, crooked foundation. There's no general contractor that would spend hundreds of thousands of dollars remodeling it without first repairing and restoring that foundation until it's stable and solid. So if you feel like your child is at a stuck point, after trying every single route of healing, from the traditional medical route to the holistic alternatives, or maybe has been hitting a plateau in their therapies and nothing seems to stick or work, it's time to start addressing first the foundation of how our bodies heal through the nervous system. So to be able to learn more about the nervous system and its continual role in our children's health and development and how neurologically focused care can help, click the link in our bio to learn more.